Good evening, everyone. Thanks for spending your evening with me, and hopefully you'll learn a few things today about the importance of our vision, and you'll be inspired to seek out an eye exam sometime in the next few months. So the topic today is the importance of annual eye exams and new lens technologies. And I don't have any disclosures, but I would like to thank a couple of my friends at Extra Light Optical Labs for helping me with this presentation, and Sue Crete from the chemistry system. Now, I'd like you to take a look at this image and ask yourself, does this mean anything to me? Some of you who are older, probably it does. What could this image possibly have to do with my lecture topic tonight? Well, let's find out. What does this image entail as a story? It involves Dorothy and the three friends that she met, and each one of them was looking for something. So the first one she met here was the Cowardly Lion, and what was he in search of? Courage. Sometimes people are afraid to get their eyes examined because they're afraid what they might find out. And when you get your eyes examined, expect to discover the strengths and weaknesses of your vision and your general health as well. Secondly, we came across the Scarecrow. And he was in search of brains. We're going to use your brains because we expect you to learn as we teach you about your eyes and your vision. Lastly, she met up with the Tin Man, and we all know he was in search of a heart. And what does that have to do with us? Well, we're going to be using glasses, contact lenses, magnifiers, exercises, eye drops, compresses, lasers, surgery, so that we can prevent, heal, and compensate for your issues. Courage to discover, brains to teach, heart to treat and heal. Those three words, discover, teach, and heal, happen to be the mission statement of not just Gavin Herbert Eye Institute, but all of University of California Health, as we try and deliver the best possible health that we can to all of our patients. This is a photo of our lovely office on the UCI campus. So those of you who are yet to come and see us there, this is where you'll be going. We have a number of specialties that I'm privileged to refer to. So while optometry is kind of the general welcoming point into the eye care world, these are some of the specialties that you may be referred to if you have any of these special problems. These are also the specialists who refer patients to me. So I work them up and get them ready for various tests and surgeries. We have retina specialists, cornea specialists, glaucoma specialists, cataract specialists, neuro-ophthalmology, oculoplastics, which has to do with lids and things around the eyes. We've got pediatrics, strabismus, which is crossed eyes, and refractive surgery for LASIK and its cousins. And finally, low vision, which takes care of people who just don't have 20/20 vision anymore. If their vision is 20/40 or worse, they need telescopes, magnifiers, and those types of things. Now, I'm going to show you a set of 4 people, and I want you to think, what do these 4 possibly have in common, and how could it relate to our story today? First, we have Ray Charles, Stevie Wonder, Andrea Bocelli, the opera singer, and finally, this young lady who you may not recognize, but that's a picture of Helen Keller. What they all have in common? Well, as you No, they were all blind. They also had another thing in common. They all asked this question. They had a question that was profound and that we need to appreciate, and that is, what is it like to see? How is it that people can see things with clarity and acuity, form, shapes, texture, shading? And we see all these beautiful images, but if you've never seen, that's a really big question. What is it like to see? So I want to preface this whole talk by appreciating this great gift of vision that we have. And I want you to understand that there are so many things that we can do to make it better for you and to keep it protected so that you have it well into your late years. Seeing your best helps you to do and be your best. And that's really what we're all about. We know that there are things that change with time, and some of them we can predict, some of them we may not be able to, but we certainly want to be prepared for them. Everything about our vision is really formed by two things, nature and nurture. Nature is what you're born with. It's the DNA from your parents. You might call it the blueprints for your eyes. Nurture is how you use your eyes, how you abuse them, trauma and injury, and disease. So between nature and nurture, we can explain virtually everything that's going on with your vision system. Now, what are some of the common complaints that people bring when they come to see me for their annual eye exam or just an exam because they're having a problem? The common complaints often include blurry or fuzzy vision. That's pretty obvious. That's why we have glasses and contact lenses to examine your eyes. And it always amazes me how often people come in and they don't really have any complaints. They just want to get their eyes checked. And then they realize how much they're missing out. I show them what certain glasses might be able to do or contacts, and they're just amazed. I can't believe I was missing out on all that. You don't want to go through your life missing out on anything. So this is a great opportunity to find out what we can do to help you. Ghost images, halos, and glare. These are things that people come in complaining about every day. And usually halos and glare are caused by cataracts, but they can also be caused by astigmatism. And we can correct the astigmatism with glasses, and we can correct cataracts with surgery. Sometimes people come in complaining of double vision, and this can be due to astigmatism, but very often it's due to the eyes not pointing the way they're supposed to. And when that happens, it could be deathly serious. We need to make sure that if it's a new onset double vision, we take care of that quickly and find out what's going on with it. If it's a long-term double vision, then very often we can correct it with a special type of addition to your glasses called prism, which helps your brain to see both images together as one. The causes of double vision are eyes that just don't point straight. They can be up and down or crossed or out, but any way you look at it, they're causing you to see double. And that's not tolerable. It really drives people crazy. So we can help you with that. Another complaint that folks have when they come in could be distorted vision. And that's very often something that's caused by the retina on the back of the eye with a blister or a ripple or a tear or something like that. So you need to let us take a look back there and help rule out any kind of macular degeneration or other issues back there. And we have specialists certainly that are really good at handling that kind of thing. The causes of distorted vision, again, these are some photos of things that occur on the back of the eye that can make you see a distorted world. So hemorrhages, blisters, irregular blood vessels, things like that, that cause the retina to wrinkle and ripple. And then very common eye strain. Virtually all of us have eye strain from time to time. And with the new technologies that we're seem to be chained to all day long with computers and cell phones and things like that, people's eyes just get strained. So having the proper glasses and viewing things the proper way and using eye drops once in a while, and then just standing up and moving around for 20 seconds every 20 minutes and looking off in the distance at least 20 feet. We call that the 20-20-20 rule. And that can be something that will really help folks out. We don't want our young kids to develop bad vision, and certainly too much close work can cause that. Floaters and flashers, this brings people in all the time. And if you look in the upper right picture there, there's a photo or a drawing of an eye. It's clear, and that clear jello ball inside the eye, this clear jello ball is called the vitreous. And it's made up of a collagen material that keeps it solid. Eventually, the collagen within that vitreous can condense on itself and form these little strings and strands that are what we call floaters inside your eye. And when the light passes through the eye, it hits those little floaters and causes a shadow. And the shadow is what you're actually seeing. In the upper left there, you can see what looks like little specks floating around in the sky. Those are the typical floaters that we all accumulate starting about age 5 to 10. They can come on very early for young people even. And those are pretty normal. We all have those when we look up at a great gray sky or something. But eventually, that liquid jello mixture can seep through the baggie in your eye. If you look down at the bottom there, it shows a baggie that's pulling away from the back of the eye. And when that happens, if it pulls away from the very back of your eye, right where the bag is attached to the optic nerve, you get what's called a posterior vitreous detachment. The photo on the left shows the optic nerve, which is the joint for where your eye and your brain connect at the very back of your eye. That's the yellow circle. The ring that's floating out in front of it is a detached bag that is pulled away from the retina and the back of your eye, and you have this posterior vitreous detachment. These are common. They happen to all of us eventually by age 65. 65% of people have one of these. By age 80, virtually all of us do. And this presents as a rather profound floater. When people get one of these, they know it. They usually come in and say, oh my gosh, this thing just happened out of nowhere. It's like a big blob floating around in my eye. And they're painless, but they're annoying. It's very important for myself or a retina specialist to take a look at one of these things pronto to make sure you don't have a retinal detachment. That's a much more serious thing. And the incidence of a retinal detachment is more like 1 in 10,000, whereas a posterior vitreous detachment is pretty much ubiquitous. We're all going to get one of those. So vitreous detachments we have to check out, make sure that it's nothing more serious than that. Dry eye. I can't say enough of that about that. A lot of people come in with complaints. They don't always know what the problem is, but it's very often dry eye. So the picture on the left shows a tear film that I've stained, and it's nice and uniform. It's protecting the eye. It looks great. And on the right, you'll notice hundreds of little chipped away dead skin cells. So just like your hands can get chapped, well, the front of your eye can get chapped too. And this is what happens when your tear film breaks up on the front of your eye. You can have this exposure of your eye directly to the air, and then you're in trouble because the skin will actually start to desiccate and chip away. On the left, you'll see a photo of a much worse problem. Hundreds of more dead skin cells on the front of the eye. and there's a strand there of mucus that's floating in the tear film, and black spots where the tear film is completely broken down and exposing the eye directly to the air out front. So that's a serious problem. That's somebody who's in pain, can't see well, and we have to get that cornea healed up with proper therapies and tears so that it can heal itself. On the right, you'll see that there's a little drawing that explains your tears aren't just water. They're a complex combination of number one, mucus, and the mucus sticks to the front of your eye. Number two, a salt water solution called the aqueous. And the third out front is the lipid layer. So those three layers, the mucin or mucus, the aqueous or water, and the lipid layer make up your tear film. And keeping that in the right balance is really what's important for keeping your tears in your eyes happy. Well, how do we do that? How do we keep your tears good? What can we do to keep them from going bad? We've got artificial tears. The best are preservative-free that come in little vials, and you put one drop in your eye every hour or two, depending on the problems you have during the day. Over to the upper right, we have omega-3 fish oil capsules, which you can take by mouth. They help to reduce the inflammation in your lids, which tends to make the oils that you're supposed to produce, the lipids, waxy. So the artificial tears, number one, the omega-3 fish oil, and the poor man's version of that down below is olive oil. A teaspoon of olive oil every day by mouth, not in your eye, can also help to keep the inflammation in your lids down low so that you can produce good quality tears so that they can protect your eyes. Finally, down at the bottom, we have something called a Bruder mask. This is something that we sell at UCI. They also sell them at virtually all the stores that have all these kinds of things that can help you out. And you put those in the microwave and you heat it up for 30 seconds to a minute, and then you lay it across your eyelids, and the heat will go into your lids, and that loosens up the oil glands. And boy, does it make your tears quality better. It makes your eyelids feel a lot better too. It helps prevent styes as well. So those are some of the things we can do for dry eye. So now we're going to shift gears a little bit and move into the area of the type of vision problems that I find. Now, these are more optically related things, and also just color and some of those kind of things. The big chart with the eye, with all the numbers on it there, the letters, that's called a Snellen chart. That's what we use to measure what's called your visual acuity. So when we say that somebody is 20/20 in one eye, what does that mean? It means that they can see at a distance of 20 feet what the average person can see at 20 feet. And if I said that their vision without glasses maybe was 20/60, that means that they could see at 20 feet what the average person could move all the way back to 60 feet and still see. We try to get people as sharp as we can with glasses or contacts, things like that. And very often we can get you seeing better than 20/20. We can get you to see 20/15. And on a really rare occasion, we can get people to see 20/10. That's extremely rare. A lot of people will brag that they have 20/10 vision, but it's really not true. There's such a small number. In my 40 plus years of doing this, I've only encountered 4 patients who could see truly 20/10. And it is amazing. One of them happens to be one of my daughters, Lindsay, who's listening right now to this, I believe. And another one was our good friend Kobe Bryant. He had true 20/10 vision when I saw him for about 7 years. And it was just exquisite, unbelievable. So there are people that can see really, really great. And we want you to do your best. We just want you to experience the sharpest vision you can. You should be excited about this kind of stuff. So nearsightedness, that's when people have problems seeing far away. And it's generally because their eye is a little too long, and we need to put lenses in front of them to push the image back further so that it focuses on the retina, which is the film of your camera. We also have people like myself who are farsighted. So our eyes are generally just a little too short, and we need powerful lenses to pull the image forward. So you can be nearsighted, or you can be farsighted, or you could have no farsightedness or nearsightedness. But with any one of those three packages, you might say, you can also have astigmatism. Now, let's break that word down so you really understand it. The root word for astigmatism is stigma. It's from the Greek and it means point. So if you put an A in front of that word, astigma, suddenly you have no point. Astigmatism means no point focus. Now, the basketball on the left there is a round spherical surface. But the football has a differential curve one way than it does the other way, and that's what causes an astigmatism. An astigmatism is this irregular surface, and it causes the blurred images that you see over there on the right side of that screen. So there's no point focus, and technically, if you really wanted to know what an astigmatism creates, I made this model, and this is called a conoid of Sturm. It's a physical shape that's created by an astigmatism, and this represents the defocus that would occur in the back of your eye, such that if your eye was, let's say, a football field long, this would be a kind of a common size and shape of an astigmatism that would be occurring in the back of your eye. So when we design lenses for you, we get it so that it creates a defocus of the light one way by the lens on purpose, and then it hits your eye and gets compensated the other way, and it all comes out clean in the wash. That's kind of how glasses work for astigmatism. Astigmatism, again, blurs you at all distances, far and near. It's caused by the irregular football-shaped cornea, and it can create those ghost or overlapping double images. And I really pride myself on trying to get the best astigmatism correction for you possible. So I'll let you turn the knobs on my machine there. I'll let you tell me which is better, this one, that one. We'll refine it to get that as sharp and clear as we can for you. Now we're going to move into a whole nother section. No matter whether you have farsightedness, nearsightedness, astigmatism, or you've got Kobe Bryant's eyes, once you hit 40, it's a whole new ball game. And that's because you start to lose your vision up close. You need a special lens to help you out with that. And presbyopia, or just being your 40th birthday candle blown out, is caused by the hardening of the lens inside your eye with age. This is a graph I made to help explain how that works. So if you see on the left side, that's your focusing ability. And when you're young, down at age 10 there on the bottom, you've got a huge focusing ability. You can focus right up to the tip of your nose and easily. As we age, looking along the bottom there, 20, 30, 40, your focusing ability goes down predictably. And we need 6 units of focusing to be very comfortable up close. And if we don't have 6, we're kind of in trouble and we're straining and we're pushing things away and we need reading glasses. So this graph explains how everybody, whether you're farsighted, nearsighted, or whatever, right about age 40, the graph crosses that number 6, and that's when people start to need bifocals. And not only that, between 40 and 50, the graph gets really steep. So the roller coaster just zooms down, and that's when everybody starts complaining, I need some help up close. And we've got great glasses that'll help you with all that. All kinds of specialty lenses. We'll talk about some of them in the future here tonight. So to summarize that business, before age 40, we lose our ability to adjust our focus because the lens is getting a little harder. After age 40, we just lose our ability to focus. You need help. You're going to have to get some glasses to help out with that. What are the solutions to these things? Well, we've got bifocals, we've got progressives and multifocals, we've got eye exercises that can help out, especially with kids. They have focusing problems, not necessarily due to age, but just due to these tasks that they're doing. And we've got all kinds of things that can help kids out. I like to look at how kids hold things and read when they're in the exam chair. And we can prescribe special glasses that help prevent their eyes from getting worse. They act as a protection, so to speak, so that they don't strain their eyes too much. If you wanted to just have a quick understanding of how straining your eyes can ruin them or cause you to become nearsighted, it's summarized in an adage that I use from the architecture world. Form follows function. So the form or the shape of your eye is really a direct result of the function that you ask it to do. Remember, I talked earlier about nature and nurture. Well, the nurture part is how you can abuse your eyes. People who strain too much, who hold things too close, who read all the time way too close, those eye muscles in their eyes are straining so hard it tugs their eye into a new shape, which is permanently focused up close. And that's not good because then they can't see far away anymore. So all these things we can deal with. We have ways of preventing problems from happening. So even if you're doing great with your eyes, bring your kids in. Let's get them checked out, get the tools they need to be successful in school. Eye alignment and coordination. These photos of people at the bottom of the screen here show eyes that are turned out or crossed or virtual up and down deviations, things like that. We have a test called a stereo test that measures your brain's ability to put the two images from each eye, one from each eye, together as one. That's called stereopsis. So we measure that and we can determine whether somebody has it or doesn't have it. Sadly, you have to develop stereopsis before age 2 or you don't get it. So that's why we like to get hold of kids early if they're having any kind of issues, or if you think a young child's eyes aren't looking straight, bring them in. And if I can't help them, we'll get one of our pediatric ophthalmologists to work with them as well. Eye movements. Everybody just kind of thinks that your eyes just move. You know, they just jump around wherever they want to go. There's actually 2 distinct kinds of movements, and they're controlled by different nervous system patterns, and they do different things. So the first one I listed there is called saccades, and some people call it saccades. But that's a jumping movement. That's your eyes jumping from point A to point B. If you're reading, you're actually doing saccadic movement. Your eyes are jumping from one word to the next, or back and forth a little bit. But that's how your eyes can move and explore a new world. On the other side, there's pursuits. These are movements that are smooth movements. They're actually flowing and they don't jump at all. They move and they're following a moving target. You can only have a pursuit if you're following a moving target. And so if you're watching an airplane in the sky, that's a pursuit. A ball is being hit to right field and you're the right fielder, you're tracking it, you're backing up. That's a pursuit. If you're watching a frisbee fly by, that's a pursuit. But these 2 types of things are different skills. And so we can find kids and adults that have problems with these and help them out. This is a picture I put in to help explain how saccades work. So the picture on the left, you've got Queen Nefertiti, and most people think that they look at a picture like that and they just see it like taking a picture of it all at once. And they get the whole picture all at once like a photograph. Not true. Our central vision is so tiny and acute, but so tiny that we have to jump around that picture many times in many places to pick up the detail that make the composite that we call this Queen Nefertiti image. And next to her, you can see all the jumping spots that somebody's eye was tracked to. Those are the saccades that move around so that the image is put together in the person's brain, all those important pieces. Likewise, the girl's face, you can see how the eye movements jump around. The eyes are extremely important. The nose, the mouth. Those are the high interest zones on a person's face that make up their image. Lastly, down at the bottom, I kind of implied before that when you're reading, your eyes just jump from one word to the next, to the next, to the next. Not true. It's a little bit more complicated than that. And you can see the sentence says, the knight attacked the windmill on his donkey. Well, the words aren't all addressed one after another sequentially. Your eye jumps from one to the other, and then further back, and it comes back a little bit and jumps around. It's picking up what it deems as important pieces of information. And this is why reading is very difficult. It's much more difficult than people give it credit for. And we can work with people that have problems with their eye movements so that they can become a little bit better at it. This is all part of something that we call vision therapy. And we have a pediatric ophthalmology department that can work with folks, and I can, and Dr. Bowie, who is our other optometrist here at Gavin Herbert Eye Institute. There's pursuits again, whether it be a bouncing ball, a flying airplane, or somebody moving a pencil in front of your eye, you're following it, that's a pursuit movement. Jumping from one to the other is a saccadic movement. So we test for those kinds of things so that we can see if you have any neural problems involving either of those. Now we're going to move into color vision. So I think you're going to learn some things this evening that you weren't aware of. And I think you might have your gaskets blown on this one because I've got some really important, really interesting information coming up here. So pay attention. There's the electromagnetic spectrum. And it's a big, broad thing that has everything from radio waves down to micro gamma waves. And there's a small, tiny little section of electromagnetic radiation right about in the middle that our eyes are sensitive to. We have 3 color cones in the back of our eyes. Those are special nerves, one for green, red, and blue. Then we have a 4th one that does black and white. So those are the various nerves that are sensitive to color and light. And the colors that we see down there are commonly referred to with the name Roy G. Biv. You've probably heard that name before, Roy G. Biv. Well, who's that guy? That's the name that allows you to remember all the colors of the rainbow. Red, orange, yellow, green, blue, indigo, and violet. That's Roy G. Biv. So that's the color spectrum. And we use a color test like I show up here so that you can determine whether you're defective in seeing some of those colors. Well, the upper left is normal color vision. The 2 on the right are red-green color defects. Those are mostly men, 6% of men. It's a big percentage. Instead of having the 3 color cones, they're missing half of one or half of 2. So they're just a little deficient in the nerves in the back of their eyes, so they don't get the full color spectrum. On the lower left, that's a blue-yellow color defect. And those are all common color defects that we see. Some women have them as well, but not many. It's mostly a men's thing. It's linked on the chromosomes, and they get it from their mothers exclusively. Their dads have nothing to do with it. It's just their moms that pass that down to them. We do have glasses that can help color defects see a little bit better. It doesn't give them perfect color vision, but it helps them a little bit. Not everybody, but some. It's worth giving a try. This next slide I put in is a little bit of a joke, but it's going to take us someplace that I want you to go to in a second. So we have color names if you're a girl on the left, color names if you're a guy on the right, and that's a little bit of a slap, if you might say. But what I wanted to introduce was this next slide. So we've got the human's view of the world, and below that, we've got a dog's view of the world. They don't have all the color cones that we do. And then in the middle, we have the regular color vision on the top, the red-green color vision in the middle, and at the bottom, the blue-yellow color defects. So I also have a graph of those three color cones and their respective sensitivities. Now, we've recently, in the past 10 years or so, found that there's a small number of women, that's genetic women who are born female, who don't have three color cones. They have four. They're called tetrachromes. And I call them a women's version of the X-Men as a kind of a joke there. But we have one of our brilliant researchers here at UCI, Dr. Kim Jameson, is working on this right now. And she's one of the world's experts on tetrachromacy. Well, then you have to enter into the world of philosophy a little bit. What is it that they see that we don't see? And I think that's just a fascinating thing. So their color vision is superior to the rest of us, and we don't really know at this point exactly what it is that they see. But an interesting topic, certainly. Sunglasses, we've got a number of things that can help you with sun and glare. Different colors do different things. Gray reduces the intensity of the brightness equally, so all color relationships remain the same. Brown protects your eyes a little bit better, protects your retina from the harsh blue wavelengths, which are high energy and can damage the retina on the back of the eye. They also cause glare more. So that's why this big fad of having blue blockers on your glasses, working on computers and things like that, can help protect your eyes, and it can cut the glare a little bit from your computers. Then there's green and yellow, all kinds of different colors for different tasks. And we have them all at the optical shop. You can come in and look around and see which you like better for working outdoors or indoors on your computers. There's transitions lenses, which change when you go indoors and out. We have those in a number of different colors. And we have polarized lenses, which act to cut the glare off of highways, sidewalks, and water in such a way that you can see a little bit better when you're looking down into the water. It cuts all the glare off the top. The only people who do not like to get polarized lenses are pilots, because they have to see the screens in their cockpits, and polarized lenses can cause that to be a little hard to see sometimes. So some drivers of cars don't like them, but certainly pilots do not like to have and should not have any polarized lenses. The rest of us, though, generally love them. They're really easy on the eyes. We have all kinds of lens materials. I'm not going to get into it too much here today, but standard plastics, ultra thin plastics, and they all have different capabilities and qualities that can make your glasses just look and feel better, lighter weight and things, and beautiful anti-reflection coatings now that are so much better than a short 10 years ago. They can help you see better, cut glare, and make you look better too. You're less glare from people looking at you. There's workplace and safety glasses that we have for folks who are just doing gardening or any kind of working with saws and things like that, swim goggles, contact lenses. You know, we've just got all kinds of specialty things. I want you to avail yourself of, come in, we're going to ask you, what kind of hobbies do you have? What do you like to do? What's your life like? Because that's how we can help you. And again, contacts, I could do a whole talk on that, but just suffice to say, we've got soft ones that correct for astigmatism, multifocals. We've got the standard old hard lenses that have been around for a long, long time, and they still do a great job for some people. That's all that they can use. We've got hybrid lenses that are hard in the center, and they have a soft skirt around the outside. So it gives you the comfort of a soft lens with the sharp acuity of a hard lens. And then we've got scleral lenses. Those are the real big ones that fit over the whole white part of the eye and the colored part. And those are for people that have keratoconus or severe dry eye or other irregularities due to scars on the front of their eyes. And those are a specialty lens that we do fit here at Gavin Herbert Eye Institute. Low vision, we have a whole low vision section and a doctor, Karen Lynn, who comes in just to see our patients for low vision. And these are going to be magnifiers, telescopes, screens that have projections that are bigger than normal, and extra lights and things like that that can all help anybody do a task a little bit better. So you bring us your task, we'll measure your vision and see if there's a tool that can help you get that task done a little bit better. That's the world of low vision. Let's go through this quickly here, but when we get behind the microscope and we're taking a look in your eyes, we look at your eyelids and lashes, and sometimes we see these little critters. These are microscopic little bugs that live in your eyelash follicles or in the oil glands attached to them or in your skin. This is called Demodex. There's two of them, Demodex follicularum that lives in the eyelash follicles, and Demodex brevis. They live in the oil glands. And like I say, they're kind of creepy little fellas. We can sometimes see them with the microscope, but usually we see the debris that they leave. And this is a close-up of them, magnified a great deal. And they produce all kinds of messy things. They come out at nighttime when you're asleep, and they crawl around on your lids and lashes and create a lot of havoc. Then when the lights come back on, they go back down in the eyelash follicles, but they cause inflammation and redness of your eyes and problems like that. Well, why do I even bring this up? Not because I want to creep you out, because I want to help you get rid of it. If you've got these problems, and they tend to be more common with older folks, but anybody can have them, then we have special things that we can do to get rid of this. You don't have to have flaky lashes like that and skin that has all kinds of redness and eyelids that are swelling and those sorts of things, all from these darn little Demodex bugs. We have all kinds of wipes and medicines over the counter, so you don't need a prescription for them, but we need to address it and make sure that you get the right treatment for the problem. So diagnosis is the key, and the word diagnosis means to know in depth. Once we get the diagnosis, the treatment is usually easily assigned to it. We know what treatments we need to do. The hard thing is always diagnosing. So let us take a good look at the microscopes to look for these problems. If we can diagnose these little critters, we'll give you the right treatment. That'll help clean things up and prevent styes and things like that in the future. Now we're going to move to our final little section about lenses. And when you have glasses that are good for far, and you want glasses that are good for the computer, and glasses that are for near, and you're over age 50 or so, those are three different prescriptions. But we can put them together in what's called a progressive lens. And with progressive lenses, they're going to create, any lens is going to create some of these aberrations that cause things to be a little fuzzy. And whether you get a progressive lens or not, as soon as you look off center from the dead center of your lens, you're going to get these aberrations. And there's quite a number of them. And I'm not going to belabor this, but I just want you to appreciate that optics is really a complicated world, and it's very sophisticated. We can take care of a lot of these things with some of the special designs and lenses that we have. A bad lens can give you low resolution and kind of blurry, whereas a good lens with the same prescription can give you a high resolution, sharper images. This elephant trunk I put in here is to help illustrate how a lens surface changes from the top to the bottom to create a progressive lens. So that's the image I want you to think of as we talk about the lens surface. And there's that elephant trunk with the various colors that show where the steepness of curvature is. Down at the bottom, a higher steepness of curvature. So what you're looking at on the right is a progressive lens. Most of you over 45 or so are wearing one of these. The pink part at the top is your prescription for distance. As you drop down in the middle channel, you pick up closer and closer images clearly. So you get your computer, and then way at the bottom, you get your near. And there's a little bit of distortions out on the sides. But if you stay in that channel, a progressive lens gives you everything you could possibly want. Now, they're great lenses. They're not necessarily the best for computer users. So we have a special lens for those folks called an office lens. The office lens has a huge green part. Imagine the green part of this lens being, the whole center of the lens, a big, huge green area. You look straight ahead, you've got the computer, it's perfect. Down at the bottom, a huge area of blue. And way up at the top, a little bit of 5-foot or 10-foot extension to get around the room. And those are the office lens, which is a great lens for people who like to play a lot of music or do a lot of crafts or woodworking or computer stuff, things like that. So we'll match the right tool for you when you tell us what kind of hobbies you have. These are some of the distortions that can occur on lenses. And there's barrel distortion and pincushion distortion. I could do a whole nother talk on that. We're going to speed through this a little bit. But distortions from inferior quality lenses can cause things to bow and look a little funny, make it a little harder to walk around. So we try and encourage people to get better quality lenses. They're not necessarily a lot more expensive, but they are better. No question about it. Why are they better? Because they're engineered. They have a surface on the front that's designed to give you the right power. You might say that the back surface is engineered in a different way to coordinate the left and the right eyes together and minimize those distortions. It's almost like these little hexagons of the lens. Each one is micromanaged. And it is a very sophisticated kind of a thing. It's done with these brilliant labs that we have both here at UCI and out in the public that we use. So the summary on the lenses there, those distortions you see in the red boxes are eliminated or mostly eliminated with the proper quality lenses that you don't get all that craziness. As a result, you get a wider, expansive field at the bottom, and your eyes have a bigger channel left to right and up and down to move around in. It seems more natural, and they are just brilliant, trust me. A good progressive lens is worth its weight in gold. So high definition on the left, crummy, blurry, low resolution vision on the right. You don't want to run around the rest of your life blurred like that. You want the sharpest thing you can get. So just let us help you with all that kind of stuff. And to summarize, come to your eye exam expecting to learn, expecting to be helped, and take the courage to come in and find out all these specific problems that you may be having so that we can help you to see your best, do your best, and really enjoy life, make the best of it. And I'll just finish off with Toto there. We'll leave him outside, although I've had plenty of dogs in the exam room, and they're always welcome. So if Dana has anybody that has any questions, I'll be more than happy to answer them. I've tried to give you a few minutes for that, and I'll let her take over from here.
Thank you, Dr. Liegler. That was terrific. There is a question in the chat, and the question is color perception affected by wet macular degeneration?
Color perception is usually not affected by wet macular degeneration. Wet macular degeneration can knock out your rods and cones, but they're more equally knocked out. So color vision typically isn't, specifically wiped out by macular degeneration.